Your health news this morning. You've probably seen e-cigarettes in stores or on display at the mall, or even seen people using them. Well, they're often billed as a healthier alternative to the old-fashioned cigarettes, but new research suggests the devices may be just as bad. Vivek Goswami with the Heart Hospital of Austin is with us this morning. Good morning to you.
Good morning. It's nice to be here.
Thank you for being here. I'd say 3 or 4 years ago, when e-cigarettes first came on the scene, maybe earlier than that, I did a story about them, and we went to the mall. We interviewed someone at a kiosk, and he was showing us how they worked. And not knowing a lot about traditional cigarettes, what is the difference between the two? At the time, he said they're better and healthier and help people who are trying to quit.
Sure, yeah, as doctors, we couldn't be more excited when people choose to not smoke conventional cigarettes. I mean, there's no question that cigarettes are one of the most modifiable risk factors in terms of heart disease. And recently, as you know, e-cigarettes and the popularity has gained tremendous attraction. I mean, the use of e-cigarettes has gone up exponentially. And it's gone up exponentially, not just amongst all Americans, but really younger Americans, including adolescents. And the question is it a safer alternative? And the short answer is there's a difference between being less dangerous and completely safe. So while most doctors would agree that puff for puff, an electronic cigarette is less dangerous than a conventional cigarette. You don't have the tar and a lot of the other dangerous chemicals that we typically see in a conventional cigarette. It doesn't necessarily mean it's not safe. So e-cigarettes, a majority of e-cigarettes still contain a high concentration of nicotine. Sometimes that nicotine can be less than that of a cigarette, sometimes it can be even higher. And as you know, nicotine is highly addictive. So if younger adolescents are choosing to use e-cigarettes instead of conventional cigarettes because the stigma is not there and they in turn get hooked on nicotine, this can then translate into a higher use of conventional cigarettes, and we've seen that by recent studies.
Yeah, so it's still not a good move. Or if a teen or an adolescent doesn't smoke at all and then decides to try an e-cigarette, well, they're not doing themselves any good at that point.
Right, so I think most adolescents now view conventional cigarette smoking as a negative thing. Some people don't like the odor. It's considered socially, in general, a non-accepted thing. And as e-cigarettes are marketed as a cleaner alternative with, different flavors, a lot of adolescents are using e-cigarettes more and more. There's been a 5-fold increase just in the last couple of years. And we know from recent studies that if adolescents use e-cigarettes, they are 3 times more likely to use conventional cigarettes in the year after that year they start smoking the e-cigarettes. And in general, 80% of the people who are using e-cigarettes are using conventional cigarettes.
Wow, those are some definite interesting statistics for sure. During the commercial break, I was talking as well about how over the years we have seen people also ban the e-cigarette. So if you thought you were getting off the hook, no one's going to smell it, it's going to be fine. Well, now you can't use them in a lot of places, and especially college campuses too.
Right, that's true. So just like cigarettes have been banned from a lot of public venues, the e-cigarette bans are coming quickly. We don't know the long-term consequences of strictly just using e-cigarettes, but certainly if there's a concomitant use of regular cigarettes, that would not be a good thing.
And I know the next natural transition is for us to talk about how to quit. We're already out of time, so we're going to put those links on our website with this story at kxan.com if you are looking for ways to quit either traditional cigarettes or get totally off of e-cigarettes. Thank you, Doctor, for being here with us this morning.
Thank you. It's a pleasure to be here.